Welcome everyone. Really excited to have an evening talking about tinnitus with Dr. Aazh. So just by means of introduction, Dr. Aazh is widely recognized for his significant contributions to the field of tinnitus, particularly research and therapy. So Dr. Aazh trained as an audiologist and actually has a lot of expertise in cognitive behavioral therapy for tinnitus, which we're going to talk about this evening. And he's really well known for helping people manage and overcome tinnitus, and his work's really expanded our understanding of tinnitus, how it's managed, and how we can improve the impact of tinnitus on patients' lives. So Dr. Aazh, welcome. Thank you so much for joining us. It's great to have you with us.
Thank you very much. Thank you for inviting me and organizing this webinar.
Great. So I'd just like to start by asking a really general question. Can you tell us a bit more about the work that you do with tinnitus?
Well, it's, my work is divided to three different things that are related to tinnitus. One, my colleagues and I see patients with tinnitus and associated disorders, and we provide a rehabilitation program based on CBT, cognitive behavioral therapy, for patients. And it is a teamwork between audiologists who are specialized in tinnitus management, and I've been working on this for several years, clinical psychologists with the interest in tinnitus management, health psychologists, and also neuroscientists who can actually help to provide education for patients. So different members of the team doing different activities. In terms of the research, I'm contributing to several different research studies. Some of them are developing questionnaires for tinnitus, assessment of the tinnitus, and assessment of the efficacy of the therapies that is done for tinnitus, and also to assess the mechanism of change in cognitive behavioral therapy, what actually happens that that can help them to minimize the emotional distress that they are experiencing, and also whether these modifications in their tinnitus-induced emotions, if you like, impact on the loudness and psychoacoustic characteristics of the tinnitus itself, which is a very important topic in modern psychology. Can psychological changes lead to physiological or perceptual changes in regard to tinnitus, and that will contribute to the theories for cognitive therapy as well. And also I'm involved in teaching to doctors and healthcare professionals about tinnitus management and disorders which are associated with it.
Brilliant, thank you. So it's clear that you're very much involved at the cutting edge of kind of tinnitus management from the psychological perspective, both in kind of actively treating people and the research that's involved. So just before I go on to the next question, for those of you that have just joined, we're going to spend the next few minutes with Dr. Aazh just talking a bit about tinnitus generally. We're then going to move on to Q&A, and you guys are going to get the opportunity to ask questions directly to Dr. Aazh, which is a really exciting opportunity. The opportunity to ask one of the UK's leading tinnitus researchers a question directly. But before we go on to that, I've got a few more questions to ask myself. So, Dr. Aazh, could you explain, on your experience, what's the biggest challenge that people with tinnitus face when first diagnosed?
Well, when they are first diagnosed is the lack of initial support and information for them. I think that's the biggest challenge that they experience, because many of them, when they have tinnitus and see their GP, and not much of the information is really given to them, maybe a leaflet or something like this, and and I tried several times to do certain projects to raise awareness among GPs about tinnitus and tinnitus therapies. I wanted to encourage them to refer patients to do CBT.
Yeah.
And then when I was in meetings with some of the GPs, and obviously I understand that they are very busy. There are so many different things that they have to deal with, and tinnitus is not really in the top of their list, and it's something that they really do not know much about. So, but I was surprised to hear that many of them even hesitate to refer the patients for a hearing test when the person goes with a complaint of tinnitus. They often say, like, we try to reassure them several times, but if they persist to coming times and times after again, and the problem is not gone away by our reassurance, then they will refer them for a hearing test or to specialist services. And so that lack of information and support is at this initial stages for patients I think is key. And they go to the internet and try to search for it, and they can see a lot of websites that claim that they have this medication or laser or this and that can cure their tinnitus. And so it's quite confusing for a patient to try to find out what is the best source of information for them.
Yeah, I'm sure so many people here will resonate with that. When they were first diagnosed with a tinnitus, when they first started experiencing tinnitus, they may have gone to their doctor, gone to their GP, and their GP may have just kind of shrugged their shoulders and said, I'm to the extent of, I'm sorry, we can't really do anything else. So, that lack of support is definitely something I think lots of people here will have experienced. So you've mentioned cognitive behavioral therapy or CBT a few times now. It would be great if you could explain how cognitive behavioral therapy, CBT, helps people with tinnitus. Why does it work?
So the idea with CBT is that the reason that tinnitus creates emotional distress in the patient, the reason that it creates anxiety is not because of the tinnitus itself, is because the person's thought process and their behaviors that leads to developing those emotions that they're experiencing. And the follow-on effect of those emotions are this impact on their sleep, concentration, mood, so on and so forth. And in CBT, basically helps the patient to gain skills and knowledge to be able to identify the thoughts that goes through their mind and test those thoughts to see whether they are helpful or unhelpful. And if they're unhelpful, they learn how to modify them and change them. And they also learn to identify their behaviors in the form of safety-seeking behaviors and avoidance behaviors. And CBT also helps them to modify those. And doing these will reduces the stress that is produced by tinnitus. And the less they're annoyed, the less they're stressed about their tinnitus, the less their focus on the tinnitus. And this is the whole principles of the CBT in this context.
Right. So it's I suppose it's about really changing how your brain reacts to the tinnitus, right?
Exactly. Changing how to consciously trying to reacting to tinnitus. So some parts of it, maybe the initial reactions that the person have to tinnitus may be so quick that it may not go through a conscious thinking process. And specifically some of the physical sensations that they may experience, like fullness in their ears, or the initial sadness or upsetness that they get, may happen so quickly that it may not be after following conscious thinking. But then after that initial immediate reaction to tinnitus, there's often a chain of negative thoughts and perceptions which lead to further follow-on reactions to tinnitus, and then creating this vicious cycle of anxiety, which whenever it is developed, basically it makes the person more alert of
Yeah.
whatever caused or triggered this vicious cycle, whether it is tinnitus or a noise in the environment or any type of a stimuli. If it creates this sort of vicious cycle, then our brain decides to basically monitors that. It's a safety thing. It's like a fight and flight response.
Yeah. Yeah. I mean, I certainly resonate with that. When I'm stressed, I can hear my tinnitus. It seems louder, and I'm sure many people when they notice their tinnitus, it's not like they choose to feel anxious. It just makes them, it makes them feel anxious in the early stages, and that feeling of anxiousness, that feeling of stress, can make the tinnitus be perceived to be louder. So let's say you've successfully gone through some CBT with a patient, and you've managed to help them change that reaction. What can the patient expect? What can the outcome be?
The outcome is usually it takes time, first of all, and it's not something that they can. It's not a quick fix, and so it is like going and learning a course in the university or a school. You have to take all of those lessons. You have to understand the theory and practice. And then you will master the skills, and then you can apply that. So at the end of the course of CBT, they should expect to have the skills to manage their own reaction to tinnitus. And research studies shows that majority of the people can gain the skills required to manage their tinnitus. Some people, it is harder for them to actually gain these skills in a number of sessions of CBT, because perhaps they are the tinnitus is so severe that it's impacting on their mental health, and they feel down and less motivated or too anxious to be able to engage in a almost scientific program. And but at the end of the day, CBT is created to help people who are anxious or depressed or have mood disorders and so on and so forth. So it's an intervention which is fit for the purpose, and it would be harder for them, but at the end of the day, it is something that has shown that can help people who are depressed even without tinnitus, or it is a treatment of choice for a wide range of anxiety disorders. So it's something that if they can engage in it, then they'll see the results.
Sure. And I suppose that kind of brings us on nicely to the topic of habituation and how CBT can help people to habituate. How would you, Dr. Aazh, how would you describe habituation? How would you explain that to someone?
I usually don't. And so I often try to avoid going into the discussion about habituations and whatever effect it may have on their tinnitus, and because it often can become a massive distraction to the CBT, and because the idea of the CBT going to this direction of the acceptance as opposed to wanting to change your tinnitus. But obviously, for the natural reason, the person who hears tinnitus have this big desire to get rid of the tinnitus. And when you talk about the habituation, and you may notice your tinnitus less, so on, so anything to do with the tinnitus, then they become very much fixated on that. And that's become counterproductive during the process of the CBT. So I try to not really talk about. I know that is something that many studies shows that will happen in majority of the people. So when you manage the distress caused by tinnitus, when you break that vicious cycle, then your brain have less reason to focus on tinnitus and bring that into the foreground of your attention. So you put it to the background, and doing so, it kind of fades away into the background. But I hardly ever talk about this with my patient during the process. And I said that the process is about, like, even if you hear a loud tinnitus, but you can sleep and you're not depressed, you can concentrate at work, you can enjoy your life. Think of that. Would that be a good enough outcome for you? And I try for them to basically focus on this. So I don't want to change anything about tinnitus. I just want to be able to live my satisfying life, enjoy my life despite hearing tinnitus. And this create that atmosphere of not going against tinnitus, the acceptance, if you like. And then the rest is an automatic kind of process that happens.
Yeah, that's really interesting. So I suppose it's about like reframing it to think about the outcome of being able to enjoy your life despite the tinnitus being there, right? So not trying to reduce the tinnitus, not trying to think about the tinnitus all the time, but thinking about the outcome of, well, yes, my tinnitus, you know, is loud, but it's not going to stop me from sleeping, or
exactly.
So that's great. So we've kind of gone through kind of the basics of CBT and talked a bit about habituation as well. I'd love to go on to talk. We've got quite a few of the attendees have submitted quite a few questions. We also had a few questions submitted beforehand, so I'm going to go through those first. Sharon has submitted a question, really interesting question, actually. I'm really interested to hear your thoughts on this. And her question is, what understanding or theories are there around musical hallucinations? And so Sharon hears 3 pieces of music. Really interestingly, it's not music that she normally listens to. So she hears jazz, trumpet solo, 1940s jazz, and these actually intermingle with her tinnitus sounds. What understanding of this, or is there any understanding of why this happens?
Well, musical, so it is at some point I was on this idea that tinnitus itself is a hallucinatory phenomenon, because it kind of matches with the description that are given in psychiatric textbooks about what is an hallucination. And but there are differences between tinnitus and hallucinations that you see in psychiatric illnesses, psychosis, so on and so forth. And the causes are usually different, and the symptoms are different, and the actual characteristics of the hallucinations, for example, in psychosis, is very different from what you see in tinnitus. But then when you move away from tinnitus, get into people hearing musical hallucinations, or some people call this auditory imagery. And this is not tinnitus. This is not the hallucinations that are described in the psychiatric textbook. So it's something, a different phenomenon, if you like. And there hasn't been a huge amount of research on this issue, and it doesn't seem to be very much related to tinnitus. And the few studies that has been on this usually shows that it is more related to hearing loss and aging process, some of the psychiatric disorders, brain damage, and drug and alcohol abuse. So these are the things that often are things that are associated with auditory hallucinations, the musical hallucinations. And there has been some physiological studies on this. And I remember that it shows that people who have this type of hallucinations, there are certain activities in their cortical brain areas which are related for discrimination of sound, and as well as memory. So obviously it's related, is memory playing an important role in this. So it is not, so it has a physiological basis for that. And from the past conferences that I have taken part, there is a Professor Tanit Sanchez from University of Sao Paulo. She has done a lot of work on musical hallucinations. So it would be, she's basically the person to talk to in that regard.
Absolutely fascinating. You know, we've still got so much to learn about how the brain works and why these things happen. Thank you for submitting that question, Sharon. So I've got another question here from Shanda. So for those of us with tinnitus but no hearing loss or physical injury, what is the root cause? Do we know what the root cause is?
But there are, well, not all of the tinnitus is related to hearing loss. So some people may hear a tinnitus which is like a pulsing tinnitus. We call it a pulsatile tinnitus, and that can be related to the arteries or turbulent blood flow close to the middle ear. Some people can hear tinnitus, which sounds like clicking sounds, which can be related to the contractions of the muscles in the middle ear, soft palate, even eustachian tube or temporomandibular joint disorder. And so these all can contribute to perception of tinnitus. And some people's cochlea, the outer hair cells, some of the sensory cells in the inner ear, they create a sound, and sometimes this sound can actually be very loud and perceived and be heard by an external listener as well, and we call this objective tinnitus or somato sounds. And so there are lots of different reasons for it. The reason that hearing loss is associated with tinnitus is because almost 60-70% of people who have tinnitus also have some form of hearing loss, and but not everybody with hearing loss have tinnitus, or vice versa. So there is probably some relationship between the two, but what is the exact mechanism between them is not fully understood.
Sure. Okay. And then a question from Paula. What can be done to? So the question is: Does wearing hearing aids make background noise worse if you have tinnitus? And is there anything else that can be done to improve hearing, but shut out noises that people with tinnitus hear?
Well, if your hearing aid is properly adjusted when you get them, so they are going to amplify the areas that you lost your hearing, and some of the background noises are also in that area, and so they will be picked up as well. If you're not using the hearing aids, you're probably not hearing those kind of background noises, and but when you do, then you'll start hearing them. And one solution for that is persistent use of hearing aids, because the more you use the hearing aid, your brain will get retrained that these are the background noises, or do not need to focus on them, and it readjusts itself to ignore the background sounds and focuses on the more important sounds. This is like normal hearing. As people who do not have hearing loss also hear all types of background noises, but our brain got used to them and does not focus on them. When you lose your hearing for a while, so your brain no longer hear background noises, and when you put the hearing aid, again you'll start hearing them. So it takes time for your brain to acclimatize to the sound that the hearing aid are generating, and but the more you use them, this problem becomes less, unless you're also sensitive to sound. And because if you are sensitive to sound, a condition that we call hyperacusis, then that makes this process of acclimatization harder for you, and you need to have special considerations to actually treat your hyperacusis before, or at least at the same time, that you are using hearing aids. So it makes it easier for you to get used to all of those background sounds.
Okay, thank you. And thank you for those of you that did submit questions before the webinar. Okay, so I'm going to go on to answer Sarah's question. So thank you, Sarah. So Sarah's tinnitus is always changing with lots of new sounds appearing and disappearing. Is this something CBT can still help with?
So I thought you said you will. Did you say you answered the question?
No.
So I thought you said you answered the question. I didn't listen.
No, sorry, no problem. No, so I think you're much best placed to answer this, Dr. Aazh. So Sarah's tinnitus is always changing, lots of new sounds appearing, disappearing. Will CBT still help her change her reaction? Is it possible for CBT to help with something like this?
Yeah, absolutely. CBT can help. When your tinnitus changes, CBT still can help, and it depends in what kind of changes you're talking about. Like if you have new noises, combination of the noises, so all of those can be taken into consideration in the CBT program. it is harder to basically learn the CBT skills if you have intermittent tinnitus in a way that it comes and goes, and for a period of weeks, you do not have any tinnitus. So in those weeks that you do not have tinnitus, that would be very hard to engage in a CBT program, which is designed to help you to deal with tinnitus. So as long as you hear tinnitus or any type of tinnitus, then you should be able to learn the CBT and apply those techniques to it.
Got it. Okay, that makes complete sense. So I suppose it depends on a few things, but absolutely yes, it's still possible to teach yourself to change your reaction to any type of tinnitus, really. So I'm going to answer a really interesting question here from Dave. Thank you, Dave. So Dave's had tinnitus most of his life, and this is something that probably has happened to quite a few people. Had tinnitus for many years, but only in the last year it spiked and it's become unpleasant for him and it's become difficult. And his question is, are tinnitus spikes physical or are they psychological? What's causing these spikes? Do we know?
Not without doing any tests. And so usually if you have a spike in tinnitus, like if you had tinnitus for a long time, and it wasn't very loud and suddenly it got louder, it is important to see an ENT doctor and audiologists who can look at your ear, see if there's an ear infection, if there is impacted wax in your ear, because impacted wax in the ear can easily cause a spike in tinnitus, or any changes in your hearing can cause a spike in tinnitus. So these things can cause, and some people talk about the effect of getting COVID-19 and vaccines for the COVID-19. These are all have shown that have some influence on tinnitus, at least in some people. And and there are some unknown factors as well that can cause these spikes in tinnitus. So it is usually important to be on the safe side if you have a spike, to see your doctor for a checkup. If they can't find anything, then it has been, the tinnitus, the spike has happened for a reason, but the reason would be unknown, and or at least it's not a dangerous thing. If it was, they would have identified that. And other things that are the more known reasons for changes in tinnitus are noise exposure. If you are exposed to noises, that can impact on your hearing even temporarily, and that can cause a spike on tinnitus. Life circumstances, stress can basically cause a spike in tinnitus, or make you more vulnerable to be affected by the same tinnitus that you had before. And the more you're affected by it, the more you hear it. So the psychological part of it would be in that way.
Okay, makes sense. So by the way, guys, I'm trying to get through. We're not going to have time for all these questions, but I'm going to try and get through as many of these as quickly as possible. So we will try to get to your question. There's quite a few people, Dr. Aazh, asking about hyperacusis, and some people are really struggling with hyperacusis. Tanya, Vesna, by the looks of things, you guys are struggling. What's the approach with hyperacusis? How can we manage hyperacusis?
But hyperacusis is very prevalent among people with tinnitus. So same as hearing loss. Hyperacusis is also around 60% of people who have tinnitus also have hyperacusis, and that is intolerance to everyday sounds in a way that sounds will you perceive them as too loud, and then it impacts on the person's day-to-day life, create distress in their life. So there are several key things in diagnosing hyperacusis. First of all, it needs to be day-to-day sounds. We are not talking about like a very noisy motorbike, or a chainsaw or something like that. We are talking about normal day-to-day sounds. People are speaking, children noises in the playground, noise in the shopping centers, things like that. They can perceive that as too loud. So This is one thing. They need to be perceiving sounds too loud, and this needs to cause significant distress and impairment into their day-to-day life. If it is not impacting on their life, then it doesn't really classify as hyperacusis. And then there are different types of sound sensitivity as well, which needs to be distinguished from hyperacusis. For example, misophonia, which is when people become sensitive to sounds related to usually man-made sounds related to eating, sniffing, chewing sounds, slurping, breathing noises, or clicking, things like that. A person with misophonia find it very hard to sit at the dinner table with their family members because of all of the eating noises. Will make them very angry and irritated and extreme emotional distress. And those noises are not necessarily loud. And people with no misophonia hardly can notice somebody else's breathing or chewing or swallowing noises, but they can cause significant distress in a person with misophonia. But it is not about the loudness. In hyperacusis, the person perceives those sounds as too loud.
Okay.
And so the loudness is the key. And in some people, it's not only they perceive the sound too loud, they perceive it as painful as well. And then again, there is another condition which needs to be distinguished from hyperacusis, and that is general noise sensitivity. And people who are noise sensitive, they find it hard to tolerate certain noises which are not necessarily loud, like the traffic from the distance, or a factory from the distance, or the noise in the neighborhood, airports, things like this. And or the general noises in the house, the cracking, the air conditioning, the radiators, things like this bothers them a lot, and they are noise sensitive. And noise sensitivity is considered as a personality trait as opposed to a sound intolerance disorder. And so this all needs to be distinguished from one another. But in terms of the hyperacusis for its management, the intervention that actually proven to be most helpful, among other things, is CBT. And the idea of this is that our brain is always amplifying sounds. So any sound that we hear is amplified within our brain. And the reason for it is because when the sound travels into our ear, it has to penetrate into the fluids of the inner ear. And when it does that, it loses a lot of its energy. So the sounds, when it reaches to the inner ear, to those tiny cells in our inner ear, it already lost most of its energy. So it's very tiny and faint. And so our brain at different stages amplifies this sound.
Okay.
And the idea is that in terms of hyperacusis, for some reasons, the brain is over amplifying sounds, which is not supposed to do. But when it does that, then it fell into that vicious cycle of anxiety. And the anxiety caused by this over amplification doesn't allow the brain to recalibrate itself.
Okay.
CBT helps the person to remove this anxiety which is generated by hyperacusis, allowing the brain to recalibrate itself, because brain can, the same way that it decides now I need to amplify this noise more, the same way it can change its mind, say, no, this noise does not need to be amplified this much. And this is the way that CBT looked at problem of hyperacusis.
That makes complete sense. So it's definitely treatable with CBT, and it's all about changing the brain's reaction, reducing the anxiety reaction so that your brain can recalibrate back to amplifying the sound in a normal way. Okay, so we're getting a few questions about the link between, on a slightly separate topic, the link between tinnitus and the COVID vaccine. If just very quickly on this one, Dr. Aazh, is there a link? Is there a link that you're aware of?
But there are reports that people had tinnitus for the first time after COVID vaccine, and some people's tinnitus got worse. And so this is real. It can happen, but it doesn't happen in majority of the people. And so this is all we know. We don't have like a proper study to say what is the exact percentage. The percentage has to be very low, and but it is as one of those side effects of this that has been reported.
Tinnitus caused by a COVID vaccine in any different way, it would still be CBT. be effective.
Exactly. Yes, CBT doesn't take into consideration what causes the tinnitus.
Fine.
It's as long as the tinnitus is causing distress, then CBT can help. If tinnitus is not causing distress, then there is no need for CBT. And so because CBT manages that distress that is caused by tinnitus.
Okay. And we've got a question here about promising developments in treating tinnitus itself, not just the response. What are you aware of that's of interest?
And well, there are some scientists who are working on this, and is at the moment is more like a shooting in the dark, because the exact reasons of the tinnitus has not been fully understood. And for majority of the people, it's like idiopathic tinnitus. They don't know what exactly is causing their tinnitus. They are trying different treatment, hit and miss. That's okay. We have found so many things with hit and miss throughout the centuries, but this is a type of research that's going on in terms of the treatment. But there are many studies that are exploring the mechanism of tinnitus, and they have made a lot of progress. And in my view, that we are at the moment are limited by much bigger streams of work in science, and we have to basically, they have to make progress, like things in gene therapy, genetics, other sciences sciences related to aging, things like this, regeneration. So we have to basically be influenced by the advances in those sciences, and those sciences are not there yet themselves. So I don't think that research on tinnitus can go huge amount further without the general stream of human knowledge goes further, so we understand more about what gene does what, and changing it, what will happen. So once our understanding is bigger on those things, then tinnitus will be one of those things that is likely to be cured, if you like.
Yeah. Okay, so it's kind of limited by our general scientific understanding, not just our scientific understanding of tinnitus itself.
Exactly, yes.
Yeah, okay. So a question here from Brannon, who's kind of torn between two different approaches between their tinnitus. On the one hand, accepting it, and on the other hand, fighting it. What do you think about this dilemma? What do you think would be the best approach here?
Well, I can understand that, because sometimes we feel that we should not give up and we should fight. And an important lesson for almost all of us in life: if you don't fight for what you want, then you are gonna lose and you don't achieve what you want. So but sometimes fighting, it becomes an impossible task, and so although it may be the very instinctive reaction that I need to get rid of this, and so it's our instinct. You didn't have tinnitus, now you have, so it's an intruder, something that wasn't there, the impediment, as some people refer to it, and I need to get rid of it. So it's your instinct telling you this. But there are many times that our instinct do not tell us the right course of action, and the solution is actually very counterintuitive way of dealing with things. And the acceptance would be that counterintuitive, as opposed to trying to fight tinnitus. And sometimes I tell to my patients that also you want to win over tinnitus, but perhaps you have to lose this battle with tinnitus and let it be to win the bigger war of life, if you like. And so it is a dilemma between our instinct and what is that the evidence of therapy is suggesting.
Yeah, it's really interesting. I mean, many people I speak to with tinnitus, many people I've spoken to that have had tinnitus and have turned the corner and have made progress with habituation, have said actually that the turning point was when they stopped fighting it, and they realized that acceptance, with acceptance came a sense of peace and a sense of calm. And it's really interesting that, but as you say, it's easier said than done. You know, it's certainly, it's not something you can just do. It does take practice. Okay, so we're going to do one more question, and that's from an anonymous attendee. Is there a correlation between initial presentation of depression, which is then followed by an onset of tinnitus? What's the correlation between depression and tinnitus?
But the tinnitus link with depression hasn't been really studied in this manner, that can depression lead to tinnitus? And if there is some studies, they are very scarce. And but most of the studies is the link between tinnitus and depression. So in a way that having tinnitus can lead to depression. And in a study that we did several years ago, we tried to create a model which started with the loudness of tinnitus to depression. And when you have these two elements together in a one-to-one model, there's a significant correlation between tinnitus loudness and depression. So the more the louder your tinnitus, the more symptoms of depression you have. But then when you add several other factors into this model, it shows that the relationship between tinnitus loudness and depression is fully mediated by other factors, like the anxiety that tinnitus produces, the impact that it has on your life, and the insomnia related to tinnitus. In other ways, when you add this anxiety, tinnitus impact, and insomnia into the model, the direct relationship between tinnitus loudness and depression disappears. It becomes insignificant. So it is fully mediated via those factors. And that's a good sense, because we don't have anything to reduce the loudness of tinnitus, anything reliably. But with the use of CBT, you can manage all the other mediating factors. You can manage the anxiety produced by it, you can manage the impact and the sleep disturbances related to tinnitus. All of those you can manage with CBT. So even if tinnitus stays exact same loudness, the depression symptoms can be alleviated through a therapy like CBT. Got it.
Okay, brilliant. So thanks so much, Dr. Aazh. Really interesting insight there. I'm just going to spend a few minutes. We've talked quite a lot about CBT and how to access it. So for anyone here that's interested in trying CBT or would like to give CBT a go, we offer CBT with Aazh. So we have a one-to-one program that will provide everything you need to get to the point of tinnitus habituation. So you'll have a monthly program which includes 2 coaching sessions with a tinnitus expert, where you'll learn CBT techniques, and then in between sessions you can practice these techniques with our mobile app. So we have an app that you can use to practice all these skills. Dr. Aazh mentioned you need to practice these things regularly, and that's exactly why we built this app, so you can practice these things. So we'll build you this personalized program, and you'll get everything you need from us, 2 therapy sessions per month, access to the app, and access to our team with tech support as well. So this costs £249 per month, but for today, we've got a really exciting offer for you guys. If you sign up today, you'll get 30% off your first month. And you just, I think, George, if you could pop that link in the chat, we'll send this link in to you via email afterwards as well. But if you click on this link and use the code FIRSTMONTH30, you get 30% off your first month. For those of you that are in the US, it's $319 per month. Dr. Aazh mentioned that it's really difficult to get help for tinnitus when you're in the early stages. That's why we built Aazh. That's why we built this program. So you can access CBT for tinnitus wherever you are, at a time convenient for you. We still have plenty of sessions available for next week. So if you wanted to get started quickly, we can get started with you quickly. If you did have any other questions about the program or how it works, please do reach out afterwards. We'll send some follow-up emails so you can just respond to me, and and I'd be more than happy to help. So I'm just going to see if we have any. So Colin, I feel your pain. A lot of money for suffering when we should have it free on the NHS. It's really, really difficult to get help on the NHS, and we know that's a problem. What we do know is that we've packaged this so you get the best value for money than you would do for paying private access. So you'll instantly access one of the UK's top tinnitus specialists, and it also includes access to the app as well. So we package this so it's the best value for money you can get. Great. Well, I just want to say thank you very much, Dr. Aazh, for your time. It's been really, really interesting talking to you and really interesting to hear your insight. Thanks very much. Is there anything you'd like to say to wrap up to everyone before we finish?
Well, thank you very much for inviting me. And, I want to thank you for setting up this, the Auto app, which provides a fantastic service to patients that, and it can be widely available throughout the world and from different places they can. And now that you also combine the Auto and automated CBT with a real person and real expert of tinnitus, they have the best of the both worlds. And so I think this is a fantastic opportunity for people, because it's very hard to actually find someone who understands tinnitus and can guide you through the CBT program. And Auto clearly is doing that. And to the gentleman or lady who said it should be free on the NHS, and I agree, but to the doctors that I was talking to, they were at one point they said for people with tinnitus, even if they think they may have hearing loss, they don't even refer to the audiology department in NHS. They send them to Specsavers or Booth to get a free hearing test. So NHS is and the GPs are quite under pressure for savings, and I can't see how in near future they can actually wrap the support for tinnitus up. And in the meantime, I hope they do in the future, but in the meantime, something like Auto that provides the support from your own home and seeing a real expert, and also getting connected with all of these webinars and learning about the new knowledge about tinnitus. I think this is the second best after a cure for tinnitus. That would be the best. So I think this is the second best that you can ask for.
Thank you very much for your kind words, Dr. Aazh. That's really appreciated, and thank you again for your time. Guys, I'm going to stay on. If anyone has any questions about the program, I'm going to stay on for a few minutes. We'll kind of finish we'll finish the webinar there. But if anyone wanted to ask any questions about the program, how it worked, I'm happy to stay on for a few minutes and answer those. Dr. Aazh, if you want to head off, you're more than welcome to stick around. But I'm going to stay on and answer a few questions about the program.
Lovely. Thank you very much.
Thank you so much. Thank you. So Diane, you said not tech savvy at all. Don't worry, we'll manage all of that for you. As long as you know how to use an email address, we'll send you links and make it really easy for you. One of the things about this program is we know how many difficult decisions there are with tinnitus, how many choices you have to make. We'll hold your hand throughout the whole thing, so you don't need to worry about being savvy with tech. If you can join this webinar, you can access the program. So Carol, thank you for the question. How long are each of the monthly sessions? So you get 2 sessions per month, and those sessions are 45 minutes long. To make these sessions as efficient as possible, to make sure you're getting the most out of these sessions, we'll send you work, a bit of preparatory reading and work to do in between sessions. So you're getting the most out of the expert that you're speaking to. And in terms of the experts that you'd be working with, so we only work with the top tinnitus specialists here in the UK. So you'd be working with one of the best. That's one-to-one sessions with one of the best. So it's really worth it, I think. let's just see if we have any other questions about there's a question here, doctor, do you have tinnitus? Yes, I do have tinnitus. Both me and my co-founder George, who's here as well, we both have tinnitus. George's is struggled more than I did, but we, it was a pain for both of us, and so we know what you guys are going through. That's why we founded the company. Great. Well, looks like that's all the questions. I just want to say thanks everyone for joining. We'll have another one next week, so please do come again. And if you have any questions that you remember, please feel free to follow up. Beatrice, how long does the program last? It depends on how long you need help for. So we'd recommend that you stay with us for between 3 to 6 months. You can cancel at any time. There's no obligation to continue. Great. Thanks so much, guys. I'm going to call it there. We will see you next week.
So what I'm going to do, if you want to sign up, is I'm going to put the link to sign up in the chat. I'm also going to email you this link afterward, but what I would do is I would take this link now. I'm putting it in the chat. And just make a note of this link so you've got it in case you wanted to sign up later. Oops, sorry, that's not the right link. I've left off the last T. So there we go, that second one. And then if you want to sign up, you can put in the offer code, which is first month 30. You just put that in and that will give you 30% discount for the next 24 hours off your first month. So just to recap, guys, let me share my screen again. We built this program. It includes everything you need to get to that point, everything you need to tune out tinnitus in a really short space of time. And that includes 2 sessions per month, 2 expert sessions. You'd be working with one of the UK's top tinnitus specialists. We only work with the top tinnitus experts. They've got between them decades of experience in tinnitus management, and some of them actually have tinnitus themselves. They know what you're going through. You get full access to our apps. You can practice what you're learning, and 24/7 support as well. So any questions you've got, we can help. In the UK, it's £249 per month. In the US, it's $319 per month. You can cancel anytime. And if you wanted to sign up and get a 30% discount, we're offering we're offering a 30% discount for the next 24 hours. There's a really good opportunity for you guys to get some help. Great. Well, did anyone have any more questions? If you had any more questions, I've got a few minutes. Mel, so unfortunately it's not covered by HMOs or Medicare yet, but it's something we're working on. Great. Well, if no one has any more questions, I am going to one more. Is using the app only practical? So great question. What's the difference between the app and the one-to-one coaching? So we've got 2 questions. I'll quickly answer these. So Mel, is using the app only practical? The app is a one-size-fits-all solution that you can learn some good techniques, tips and techniques to get on top of your tinnitus. If you want to get fast results, then the one-to-one program is for you. If you want someone to just tell you what to do, the one-to-one program is for you. If you're happy to kind of learn things on your own and work your way at your own pace through the program, then the app is good to try. We find that people get to habituation within 3 to 6 months with the one-to-one program, but the app will take kind of 8 to 12 months for a normal person. So it's much faster. Michael, is habituation for life? Yes, it is actually. You can get a tinnitus. So once you've habituated, you can go through again a stressful period. You can get a tinnitus spike, and your tinnitus can get louder. But if you've habituated before, you can habituate again, and it's a lot easier to habituate the second time once you've done it the first time. And, you know, you will always be able to do it easier once you've done it again, and it's going to be a much easier process. But you know, the habituation does last for, you know, it's not common for tinnitus to get really severe after you've habituated again. Question from Julie: if you already have the app, how much is the CBT program? So it would be the same. What we would do is we would get you to cancel your app subscription. We can refund any recent payments that you've made. So the cost would be the same. We would just refund the app subscription or any payments you've made for the app. Daryl, question: does the longer you've had tinnitus impact time to habituation? Not at all. Doesn't have any impact. There's lots of things that can have an impact on time to habituation, but in my experience, time that you've had tinnitus doesn't have an impact at all. But good question. That's not something I've had asked before. That's a really good question. Great. Well, guys, thank you very much. Just as a reminder, make a note of that link. Make a note of that link I've sent there if you do want to sign up. That code will expire in the next 24 hours. I'm going to email you all. I'm going to email you all anyway with the link and the code. If you have any questions, please do drop me an email. We're here to help. But thank you very much for joining us this evening. It's been great. We've got another one next week. So please join us again next week. We've got a really exciting special guest for you. Okay. Thank you, everyone. Goodbye.